My name is Reggie Gilstrap, and this is my trach care video and suctioning. Knock, knock, knock. Just me, the student nurse. Provide for patient privacy and hygiene. Hello, Mrs. Gilstrap. How are you doing today? Oh, that's good. So my name's Joey. I'll be your student nurse. What I'm here for is today I'm going to conduct trach care and suctioning. Is that okay with you? Okay, it'll take about 10 or 15 minutes, so it's okay if I perform this procedure? Okay, awesome. So I'm going to go ahead and raise your bed to hip level just to make it easier on me, okay? I'm going to place you in the sitting up position or Fowler's position. I need to listen to your lungs real quick, okay? And that's just so I can establish a baseline of what you sound like. In and out. Okay. Alright, ma'am. So for this procedure, I'm going to need a hyperoxygenate or give you more oxygen than what's needed. And that's because you may be deprived of oxygen during the procedure while I'm suctioning it out. And that's to help you with oxygen, okay? Okay. And I would do that per my hospital's policy, okay? So I'm going to go ahead and conduct hand hygiene. And at this time, I would don a face mask or eyewear if I had any, or if it's needed. Then I'm going to go ahead and open my suction kit. I'm going to go ahead and don my gloves. This is a sterile procedure. Not to touch the outside of the glove. With this one, I could just pick up, hold underneath the cuff. I wouldn't be wearing any jewelry or anything doing this procedure. So this is my basin. It's clean, so I don't have to worry about that. Alright, now with my non-dominant hand, I would take the saline and pour the saline in the basin. And I would coil this up in my dominant hand. Like so. Alright. So with my non-dominant hand, I would go ahead and turn on the suctioning device, which would be located on the wall around here. So I would go ahead and turn on the suctioning device. And I would turn that on to about 100 to 120, and that's for an adult. Alright, and then with my non-dominant hand, I would take the suctioning tubing and connect it to the suctioning regulator. And it would be like this. So it would be connected like this, like so. But it's not going to connect to this. But this is the regulator. When your hand is over it, it's suctioning. When it's not suctioning. Alright. So what I'm going to do is go ahead and dip the tip of this catheter. The tip of the catheter. I'm going to go ahead and dip in this saline. And that's to moisten it up to help get it inserted better into the patient. Alright, so with my dominant hand. Alright, ma'am. So now what I'm going to do is I'm getting ready to stick this in there and start suctioning, okay? When I do this, it's going to take between 10 to 15 seconds from the time I put it in to take it out, okay? So that's just a heads up. Alright, so I'm going to go ahead and insert this into my patient's trach. And I'm going to keep going down until my patient coughs or I meet resistance. At that point, I'll stop inserting it. Once I've reached that cough or that that resistance, I'll withdraw it about a ½ inch and then suction. So I'll put this on and suction. Take it off, and we're doing intermittent suctioning. So I'll rotate this out, pull it out a little bit, suction. Continue to do that all the way up, and then I'd pull it out, and like I said, between 10 to 15 seconds. So insert. All right, man. In. Patient coughed. Pull it out a ½ inch. Suction. 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 And it's out. Alright, once I've taken it out, I can go ahead and rinse it in my sterile saline. So I'll put it in, suction. And that'll get any debris that I got caught in it, get it out and clear it, and get it ready for a second pass. And then I'll repeat those steps again for a second pass. Man, I'm going to do it one more time, okay? Insert, insert, insert. Patient coughs. ½ inch out, suction. Intermittent, pull out some, suction. Pull out some, suction. Alright, and I got it out. Then I'm going to go ahead and disconnect this from the suction, and I can go ahead and discard this because it's trash now. So I can go ahead and get rid of it and my gloves. Alright, so I'm going to go ahead and move this stuff. Get it out of the way real quick. So now I'm going to do trach care. So with trach care, I have a trach care kit. Same thing, open away. Place my gloves on the same way. Touching the underside, not the overside. Then grab this one with my non-dom, grab underneath the cuff. These gloves are really small, so it may rip. Alright, ma'am, so I'm getting ready to perform care, okay? This will only take about 5 to 10 minutes, okay? So the first thing that I'm going to do is, I don't even need, this would be my normal gloves, not sterile gloves. So these would be normal gloves that I put on. And what I would do is, I don't know why I confused that with sterile gloves. So yeah, normal gloves. So I would put on normal gloves. Alright, ma'am, I'm going to go ahead and remove the dressing, okay? And what I'm looking for when I remove this dressing is I'm assessing for color, odor, consistency, and, you know, just any discharge that they have. I'll remove the suctioning equipment and throw the gloves away. So I'm taking these off and throwing them away. But I actually need these. So time out real quick. So now I have my sectioning kit. Go ahead and place that down. Conduct hand hygiene, and open my trach care kit. So take my trach care kit. This is another sterile procedure. just like before, underneath the collar. Oh man. Big thing is don't touch the outside of the glove. So I have that on. Grab this by the collar. This glove is ripped, so if this was a real one, I would have to get a whole new kit. Alright, so now that I have these on, I'm now sterile. I would go ahead and pre-moisten my cotton tip applicator. I would moisten it with sterile saline along with the gauze. So now what I'm going to do is I'm going to go ahead and gently insert a new inner cannula, and I would go along with the curvature. So ma'am, I'm going to go ahead and insert this cannula now, okay? I would go with the curvature of it. I don't have a fake cannula. And then put it in the lock position to make sure that it's locked and steady. So once I do that, after I do that, I'm going to go ahead and clean the outer cannula and trach site with cotton tip applicator. So this was already pre-moistened, so I'm going to clean it in a circular motion away from the site. And if I need multiple, then I would use multiple cotton tip applicators until I clean the outside of the site, and then I can trash this. I would trash my cotton tip applicator and any gauze that I used. All right, ma'am. So now I'm gonna go ahead and excuse me, and I'm gonna go ahead and put a new dressing on. Okay. So I would stabilize the trach tube with my non-dom hand and place this fenestrated dressing underneath the flanges of the outer cannula. Once I've done that, I'll replace the trach ties one side at a time. And once I've done that, I would tie it in a square knot to keep it secure. Once it's secure, I can go ahead and take off my gloves, throw whatever trash away that I need, and then ask if there's any questions with my patient. All right, ma'am. Do you feel any discomfort? Are you feeling okay? Do you have any questions about what we did? No? Okay. Well, if you have no questions, are you in any pain at all on a scale of 0 to 10, 0 being no pain, 10 being extreme pain? No? No pain? Alright, so I'll place the side rails up, put the bed in the locked position in its lowest position. I would make sure my patient has their call light. I would thank them for allowing me to do the procedure. And then I would conduct hand hygiene and walk out. I would then write my patient's chart. I would document the type and size of inner cannula, the technique I used, which was sterile, amount of oxygenation, which is per protocol of your hospital, the procedure that was performed, which was suctioning and trach care. Other than that, I would put down the description of any secretions that I got, the patient's response, their tolerance to it. I would then sign and initial the documentation. And that is my trach care and suctioning.